Dan Buettner, folks, is an explorer, National Geographic Fellow, award-winning journalist and producer, and New York Times best-selling author. He discovered, I think we all know this, he discovered the 5 places in the world dubbed blue zone hotspots where people live the longest, healthiest lives. His articles about these places in the New York Times Magazine and National Geographic are 2 of the most popular for both of those publications. I'm excited to hear more about this. Buettner now works in partnership with municipal governments, large employers, and health insurance companies to implement Blue Zones projects in communities, workplaces, and universities. Blue Zones projects are well-being initiatives that apply lessons from the Blue Zone to entire communities by focusing on changes to the local environment, public policy, and social networks. Nice transition from these last few slides of Dr. Nestle's. The program has dramatically improved the health of more than 5 million Americans to date. His books, The Blue Zones, Lessons for Living Longer from the People who've lived the longest, Thrive, Finding Happiness, The Blue Zones Way, The Blue Zone Solution, and Eating and Living Like the World's Healthiest People, and The Blue Zones of Happiness were all national bestsellers, and one of the Blue Zones books is the best-selling book in America. It's Blue Zones Kitchen, best-selling book in America right now. It's remarkable. In case he hasn't accomplished enough, Buettner also holds 3 Guinness World Records in distance cycling, and most important of all, he's my neighbor in Minneapolis. Please join me in welcoming to the stage Dan Buettner.
Other people might be starstruck with Mick Jagger and Madonna, but my rock stars are Marion Nestle and Henry Blackburn. So I just can't tell you how excited I am. I'm a little humbled. Spent 15 years looking at these giants, and now I get to share a stage with them. I spent 20 years studying longevity for National Geographic, and I found when it comes to longevity, real longevity, what you have to do to live a long, healthy life, most Americans are misguided or just plain wrong. And as a demonstration that I thought it'd be fun today, by taking just 2 minutes to calculate each and every one of yours life expectancy. And in order for me to do that, I need to ask you 8 quick questions, and your job is to raise your hand if the question pertains to you. And number 2, the hard part before coffee here is remember how many times you raise your hand. So first question, raise your hand if you sleep at least 7.5 hours most nights. 7.5 hours most nights. All right, say 80%. Raise your hand if you move at least 45 minutes a day. Doesn't have to be, it could be walking. Okay, I'd say 60%. Raise your hand if you eat at least 3 honest servings of vegetable, not ultra-processed, and French fries and ketchup do not count. 3 honest servings. All right, most of you. Raise your hand if you have not had unprotected sex with a stranger. Marion, your hand should be up for this one. These are real questions. Raise your hand if you have at least 3 friends who meet the following criteria. Number 1, you can have a meaningful conversation with them. Number 2, you can call them on a bad day and they'll care. And number 3, you actually like them. 3, there we go. There's the good neighbors from Minnesota. Raise your hand if you belong to a faith. Could be Catholic, Jewish, Muslim, doesn't matter. And keep them up if you show up 4 times a month. All right, we have 1 hand in the back there, okay. Raise your hand if you have not smoked in the last 5 years. And we're not in California, I mean tobacco. There we go. Thank you, Blue Cross Blue Shield and the university. Raise your hand if you believe you have the health and the desire to reach age 90. Health and desire. That's the biggest predictor right there on most of you. Okay, so these are the biggest predictors, among the biggest predictors of how long you could live. And this assumes an average age of 40. And looking around me, I can see you guys are much younger than that. But I can get within a margin of error of 10% for an average population. If you raise your hand twice and you're a man, life expectancy is 78. If you're a woman, it's 82. If you raise your hand 5 times and you're a man, life expectancy is 84, a woman's 88. And if you raise your hand at least 7 times and you're a man, life expectancy is 89, and for a woman, it's 93. Did anybody raise their hand all 8 times? Anybody raise their, right here, ma'am? You two, could you guys stand up, please? Can we get a big University of Minnesota School of Public Health round of applause? You 3 are now dismissed to Stub and Herbs. We got cocktails waiting for you. The rest of you, you can stick around. So something called the Danish twin study established that only about 20% of how long the average person lives is dictated by the genes. Your other 80% is lifestyle and environment. And about 15 years ago, with funding from the National Institutes on Aging and on assignment for National Geographic, we set out to, in a sense, reverse engineer longevity, to find the statistically longest lived parts of the world. This took 2 years alone, and then go to each one of those places with the methodology to find what the common denominators on that most explain longevity. Among my experts who helped me put that methodology together, first and foremost, is the late Bob Kane, who was a chair of long-term care and aging, really the first guy to say, yes, this has merit, and connected me with the National Institutes on Aging. I have enduring gratitude to him and the school for that. But several other experts, and we tried to be as rigorous as possible to really distill out what's explaining longevity everywhere. And remarkably, we found 9 common denominators. I'm going to tell you those 9 common denominators, but first, I'm going to take 3 minutes and quickly take you to each of the blue zones, since I have the benefit of National Geographic photography. The first blue zone off the coast of Sardinia in the highlands, the Nuoro province, 5 villages, 70,000 people with the highest concentration of male centenarians in the world. This really launched the blue zone in the year 2004. Okinawa, Japan, the highest concentration of female centenarians in the world, about 30 times more female centenarians among a cohort of women 60 and over, really extraordinary. United States here, Loma Linda, California, the Seventh-day Adventists, the highest concentration of Adventists. They're conservative Methodists, live here in Loma Linda. Our government, NIH, has funded an extraordinary study that followed 103,000 Americans for 30 years. This is gold standard epidemiology. Life expectancy of women in this country is about 80, but for Adventists, adherent Adventist women, they're living 9 years longer, and for men, about 11 years longer. So here you have people living right off the freeway next to a Wiener Hut and a Del Taco, and somehow they're living a long time. Part of their reason is they take their diet directly from the Bible. I'll talk more about that in a minute. I wrote up this story for National Geographic and a book that did very well, and for the first time in my life, I had money. And I went and took that money and blew it on hiring the demographers that I met doing the expeditions for Geographic to go find more blue zones. We found the 4th one in the Nicoya Peninsula of Costa Rica, lowest rate of middle-age mortality in the world there. And remarkably, they spend 1/15 the amount we do on health care. Part of the reason is their diet, very low processed beans, corn tortillas, and squash. That was about 70% of their dietary intake. But because we're here to talk about public health, they've done something really extraordinary when it comes to health. Rather than spending the majority of their money on fixing problems after people develop heart disease, they've invested in these basic health teams. They're called e-BICE. And they're composed of a physician, a nurse practitioner, a record keeper, and 2, I call them health ambassadors, roving health ambassadors. They're each assigned 5,000 people, and every man, woman, and child in Costa Rica has the right to 1 free visit a year. And these roving, this is one of them here, Isabel. She will visit about 1,200 households a year. She'll come around and she'll review your health records. She'll take blood pressure. If diabetes is indicated, she'll take a blood sugar level. She'll screen you for depression. She'll go in your backyard and look for standing water for signs of Zika water where mosquitoes who breed diseases like Zika and dengue and malaria. Then go into your refrigerator and look for signs. Those are infectious diseases, so go in your refrigerator to look for signs of chronic disease, and thereby catching a disease before it's a full-blown problem. We wait in America, all the incentives in America are around getting sick people less sick rather than keeping them healthy. And nobody makes money in America by keeping people healthy. We make money by a prescription for a drug, or going to see a doctor, or getting a test, or renting a hospital bed. If you want an outcome, you look where the money originates, and here the money is spent on prevention, which probably explains why the poorest people in Costa Rica are the healthiest. They have the highest life expectancy in Costa Rica and the longest telomeres. Finally, the last blue zone here in the Ikaria, Greece, off the coast of Turkey. Remote island, was largely overlooked by Western civilization because they have no natural ports. But amazingly, this place not only lives about 7 years longer, almost no dementia. We actually deployed the same cognitive test the NIA uses for almost everybody on the entire island over 65, and saw about 1/5 the rate of dementia we see here in the United States. So they stay old, they reach very long advanced ages, but they arrive there sharp with all their mental faculties in place. Not coincidentally, they have the strictest version of the Mediterranean diet in the world. There's something called a med score, which actually measures adherence to the Mediterranean diet, and these Icarians do it better than anybody else. I don't have time to tell this story. Well, this is a guy, I wrote about him in the New York Times. He said he forgot to die. And of course, I asked him why he forgot to die. I was pretty sure it was not his ability to match plaids, but he just sort of shrugged, which really underscores better, or articulates better than any of the 65 or so longevity experts I interviewed for this story in the book, of what really explains longevity. The reality is, no matter where you go in the world and you find extraordinary agers, it's never because they tried. None of these spry 100-year-olds who are standing on their heads or water skiing ever said, well, go darn it, at age 50, I'm going to get on this longevity diet and get healthier. They didn't have an elliptical in their basement, or join CrossFit, or call an 800 number and buy supplements, or buy superfoods. In fact, for the most part, they had no idea why they were living so long. Longevity happened. They didn't pursue longevity, it ensued. And therein lies the organizing tenet of longevity places everywhere. Longevity ensues. It has to be the result of the right environment. And no matter where you go in the world and you find extraordinary longevity, largely there's no exercise promotion. And by the way, this is going to sound disrupted, but exercise has been largely an unmitigated public health failure. We spend hundreds of millions of dollars on exercise programs, and the average American burns fewer than 100 calories a day engaged in exercise. It doesn't work. What works in blue zones? Every time they go to work, or to a friend's house, or to school, it occasions a walk. They have gardens out back. They haven't engineered all the physical activity out of their life with mechanical conveniences. They still do lots by hand. My team figured they were nudged into movement every 20 minutes or so. They suffered from the same stresses that we do, but they had sacred daily rituals like prayer and nap taking and happy hour to reverse that stress. They had vocabulary for purpose. People who can articulate their sense of purpose live about 8 years longer than people who are rudderless in life. That's been well documented. Mary Jo Kreitzer from we have one of the best purpose centers here. I saw her in the audience somewhere here, but we have one of the best purpose centers in the world right here at the University of Minnesota. The right idea, better than, if we could somehow put you in a capsule, Mary Jo, you would be a blockbuster drug. When it comes to eating, good news here at happy hour, they do drink a little bit, about 2 glasses a day, but you cannot save up all week long and have 14 on the weekend. Largely a plant-based diet. For this book, The Blue Zone Kitchen, which is just out this week and doing very well, we did a meta-analysis of 155 dietary studies in all blue zones. They're not flawless, but still we were able to see what people were eating in blue zones at the population level 60 or 70 years ago, all the way through today. This slide took me 8 years to discern or distill. In blue zones everywhere, 90 to 100% plant-based, very high carb diet. All this gibberish around keto and paleo, I don't believe any of it. People in blue zones were clearly eating carbs like whole grains, greens of every sort, nuts, and about a cup of beans a day. I think beans are the food that could save humankind, among the most sustainable in the world. And if you're eating about a cup of beans a day, it's associated with about 4 extra years of life expectancy. Very little meat in the blue zones, fewer than 5 times a month, not as much fish as you'd think, no cow's dairy at all. You do see some pecorino or sheep cheese. They don't like me very much over in Wisconsin. Very low in added sugars. The average American consumes about 22 teaspoons of added sugars, most of them unconscious. In blue zones, it's about 7. And then when it comes to what they're drinking, water, tea, good news here, coffee, not the macchiato, black with a little soy milk, and then a little bit of wine. This is what centenarians ate to be 100. So it wasn't discovered in a test tube or in a laboratory. It was real people who achieved the health outcomes that we want. They focused less on what to add to their diet and more on what to take out. Eat breakfast like a king, lunch like a prince, dinner like a pauper. They're not eating food to their favorite TV show. They eat with their family. And then the foundation on which most longevity rests, they invest in their families, keep their aging parents nearby, thereby imparting 4 or 5 extra years to their aging parents. They tend to belong to a faith. I'm not a particularly religious person myself, but people who show up to church, that's why I asked you this question, live 4 to 14 years longer than people who don't. I would argue that one of the most cost-effective public health interventions is to get inner city people involved in faith. That 14 extra years of life expectancy, inner city youth, if you get them involved with church, are way less likely to get involved in risky behaviors. And then perhaps the most germane one to most of us is pay close attention to who we're hanging around with. We now know that if our 3 best friends are obese or overweight, there's a 150% better chance that we'll be overweight ourselves. Our alcohol use is addictive or is contagious. Obesity is contagious. Smoking is contagious. Even loneliness is contagious. So as my grandmother used to say, show me your friends and I'll tell you your future. It's a really important idea to carefully curate that 4 or 5 people who you're spending most of your face time with. So people look at this and say, well, sounds like common sense to me. But it's not. In America, we pursue health or prevention through diets, supplements, and exercise programs, and they're not necessarily bad ideas, and they occasionally work in the short term, but they universally fail in the long term. Take diets, the best diets. You get 100% on day 1 of people who sign up, adherence on day 1. You're down to 90% in just 3 months, and you're down to 10% in 7 months. Our minds are hardwired for novelty. We're deluged with information, and as Marion points out, confusion. We get on the next thing, and within 3 years, fewer than 3% stick on diets. Same with exercise program. We start with lots of zeal after the holidays, and we run out of gas by September. And even if I come back from the blue zone with the supplement guaranteed to slow aging, Americans wouldn't take it long enough to make a difference. So if that doesn't work, what does? So people in blue zones, they're eating largely a whole food, plant-based diet, moving every 20 minutes or so, because their lives are underpinned with purpose. The people they surround themselves with are reinforcing the right behaviors, and they live in places where the healthy choice is not only the easy choice, but also the unavoidable choice. And the magic, the secret, doesn't really lie in any of these circles. The secret lies in the interconnected, mutually supporting web of characteristics. Because when it comes to longevity, there's no short-term fix. There's no pill, there's no supplement, there's no superfood that you can take today that's going to affect your life expectancy in a year. So unless you're thinking of years or decades, don't waste your time at it. In blue zones, people are doing these 5 things for decades because the other factors, all 5 of these factors help reinforce each other. So this was the general construct I had in mind in 2009 when I had the idea of trying to manufacture a blue zone. Can we take these ideas from Sardinia and Okinawa and apply them to the United States? And when I started looking around for the literature, I started at Harvard and Yale and eventually landed right here and found the best information and best experience right here at the University of Minnesota. And that's what first took me to Henry Blackburn. Henry Blackburn was not only a part of the study, he and his colleague Ansel Keys at identifying the Mediterranean diet and systematically seeing this connection between diet and heart disease. This is back in the 60s and 70s. When Daddy died of a heart attack, we thought, well, he just died of old age. People didn't realize that eating a 12-ounce steak is connected to clogged arteries and so forth, and that was really the work of Henry. And Henry went on with his wife Stacy to create these heart healthy studies in Minnesota, which took the first systematic approach at trying to create healthier environments in cities. And his generosity and inspiration and giving me access to his research really helped enable me to do a 2.0. So in 2009, with collaboration from the University of Minnesota, and I thank John Finnegan here because he brought the best minds at the School of Public Health together, and I got a big grant from AARP to build a model which is now active in 40 cities in America. It assumed, first of all, that individuals are genetically hardwired to crave sugar, fat, salt, and take rest whenever they can. And if you try to override our genetic impulses, you're going to fail in the long run. So we basically forget the individual. Basically forget behavior modification, which doesn't work. And instead, focus on something we call the life radius. And take on, so most Americans spend most of their life within about 5 miles of their homes, especially if you live in a smaller city or New York City, for example. And go about changing the defaults comprehensively throughout the entire system so that people are nudged into better behaviors, largely mindlessly. And we organized 3 squads for every city. Our very first city was Albert Lea, Minnesota. And the first squad focused on people. And there's some tipping point theory where if you can get about 15% of the adult population to do things, it starts to spread by itself. So we try to get 15% to become Blue Zones ambassadors, to take checklists into their home, to optimize their kitchen and their house so they were nudged into moving more and eating less. We created these social networks around walking and plant-based potlucks. Walking groups don't work very well unless you can create friendships around them, so we spend extra effort making sure people are connected according to their interests and their values. And then we gave them a purpose workshop and got them to volunteer. Volunteers have lower BMI, they have lower rates of heart disease, lower healthcare costs, and altruism tends to be contagious and tends to be addictive, so it lasts a while. Our second team administered a Blue Zone certification program. In every city we work in, we try to get at least 30% of all stores, large employers, restaurants, schools, and churches to become Blue Zone certified. So we changed the designs and we changed the policies in those buildings. So you wake up in the morning, your house nudges you into slightly better behaviors. No matter if your kids go to school or you go off to work or you go shopping, you go restaurant, it's just ubiquitous. You're mindlessly nudged into slightly healthier behaviors. And then really the big one is policy. Now, I don't work at Marion's level. Marion is taking on the Leviathan of federal policy. But I find actually you can get a lot done if you focus at the municipal level. City councils are nimble. There's lots of great committed leaders at the local level, so we focus on that. And what our team does is we believe we have the best, one of the best teams in the country who have aggregated policy menus that there are 30 or 40 evidence-based policies that favor unprocessed food over ultra-processed food, that favor the pedestrian over the motorist, that favor the non-smoker over the smoker, and that favor policies that make alcohol a little bit less accessible than they are today. And you can have extraordinary, the most cost-effective way to make a population healthier is not with yoga or CrossFit, it's with getting cities to adopt the right policies. Let me just give you a couple examples. If you can get your walkability score up from about 50 to 90, so looking less like Tallahassee and more like Boulder, Colorado, or San Luis Obispo, or even Minneapolis, the physical activity level of that entire city goes up by about 20%. You don't have to hound people to get their exercise. You just make it easy for them to get around. If you live in a neighborhood that doesn't have billboard advertising, that neighborhood, controlling for everything else, has about 8% lower obesity rates than the same neighborhood that allows billboard advertising to remind them to get a hamburger after work or pick up a six-pack of Coke. Places like Boulder and San Luis Obispo have had the courage to say, we don't want billboards in our city, and the ordinance is passed, no billboards. And guess what? Nobody misses the billboards except the guy who owns the billboards, and they have among the lowest rates of obesity. If you live in a neighborhood where there are more than 6 fast food restaurants, obesity rates there you're 30 to 40% more likely to be obese than if you live in a neighborhood with fewer than 3 fast food restaurants. Well, guess what? City Council has the right to pass an ordinance or to limit the number of licenses for fast food restaurants. So the reality is, if you put goggles on and you systematically look at the populations that we live in, there are dozens and dozens of opportunity to slightly nudge a population into better health. And the point is, you have to get away from a silver bullet approach and look at silver buckshot. Unleashing a healthy swarm of nudges and defaults at the population level that mindlessly make people make slightly better decisions for the long run. Can this actually work? 2009, we auditioned 5 cities here in the Twin Cities, in Minnesota. The U of M said, start with a city of about 20,000 people. And we didn't show up and say, guess what, we've arrived as your saviors. We turned it around. We said, we have this great program, now sell yourself to us. And we made mayors, city managers, Chamber of Commerce, city council, superintendent of schools, head of the hospitals sign a pledge. We showed them our approach. We said, if you want us to come, demonstrate to us that you really want us. And Albert Lea, Minnesota, 90 miles south of here, said, we're in. And they let us unleash this healthy swarm for about 2 years. And over the course, that life radius model I showed you, we just worked the system for 2 years. Life expectancy went up by 3.2 years. We shaved over 2 tons off of their wasteland lines, and the city itself reported 40% drop in healthcare costs among city workers. It attracted all kinds of national attention. Not because we were successful in convincing 20,000 people to change their individual behavior. It's because we changed the environment. And once you change the environment, the culture begins to follow. And now, Albert Lea self-describes as a healthy city. And when this idea of limiting vaping in schools, they cited blue zones to be one of the first local cities to prohibit vaping around school grounds. So it's thinking long-term rather than short-term fixes. Our phones started ringing off the hook. We got 90 requests to do other blue zone cities around the country. We ended up picking the beach cities of California. Very different culture, but we worked the same system. Long-term changes to the environment at the place level, the people level, and the policy level. In 5 years, and this is reported by Gallup, we were able to bring the BMI level at the population down by 17%. And by the way, the rest of California only dropped 3%. So this was against California controls measured by Gallup. Smoking went down. Physical activity, or daily stress levels went down. Physical activity went up, and people reported higher life satisfaction, which essentially is happiness. This caught the attention of the Blue Cross Blue Shield plan of Iowa. They asked us to come over and blue zone the pork state, a formidable challenge. Same thing. We auditioned 90 cities. We picked 10, and for the next 5 years, we blue zoned these 5 cities and created an institute. And then, most significantly, the reddest city of the reddest state in America, Fort Worth, Texas. They call it Cowtown. Dan Buettner, Blue Zone, shows up with his plant-based initiatives. Believe it or not, they embraced it. I just want to show you a quick 2-minute clip that will sum it up better than I could in 2 minutes. This is from the NBC nightly news that aired a few months ago.
All right.
When we rode into Fort Worth 3 years ago, Mayor Betsy Price was on a mission to rescue her beef-obsessed, obesity-plagued city.
You guys are on life support here. It's not so good.
We're really way down there.
Back then, they were one of America's least healthy cities, with soaring healthcare costs, stressed-out commuters, and overweight school kids.
I'm ready to rock.
But the health-conscious mayor found inspiration thousands of miles away, in remote places where people live longer and healthier than anywhere else on Earth. National Geographic fellow Dan Buettner discovered the blue zones a decade ago. He took us to one of them, Sardinia, a couple of years ago.
The longest lived men on the planet live right around here.
People here are always on the move, often up hills, eat a mostly plant-based diet, and wash it down with a glass of wine. Family ties are important too. Common threads throughout most blue zones.
What you've learned is there's no silver bullet.
It's 20 or 30 little things, but they're little things that you can transport from places like Sardinia and bring them home and have them work for you.
Back in Fort Worth, the mayor asked Buettner to help her do just that, convincing big steakhouses to put healthier choices on the menu.
Portobello mushroom is completely different.
Acorn squash.
Having police hand out fresh vegetables and fruit instead of tickets, and encouraging everyone, even Sunday morning churchgoers, to exercise.
I don't even recognize that girl anymore.
Latasha Dandy says the Blue Zones project inspired her to shed 70 pounds.
My goal was to start changing little things to feel better, and then it was like I woke up and the weight was gone.
She's not alone. Fort Worth's child obesity rates have dropped 6%. In fact, a Gallup poll of America's healthiest cities says Cowtown is changing its tune.
We've jumped from 62 to 47. We've jumped up 15 slots in 4 years. That's a long way.
They say everything's bigger in Texas. Well, it's the little things imported from places like Sardinia that are making Fort Worth healthier. Cynthia McFadden, NBC News, Fort Worth, Texas.
So now we're in 50 cities. We're just starting in Orlando, Florida, which is even going to be a bigger challenge, I think. But the point here is we have a big health problem in this country. As most of you probably know, 70% of us are overweight or obese. That number keeps climbing. Life expectancy has dropped for the last 3 years, for the first time since 1917, especially with our children. We're spending about $3.7 trillion a year on largely avoidable diseases. Is that because we're stupid, or we lack individual responsibility, or we love our kids less than our parents loved us? In 1980, we had a third the rate of obesity we have today. Why is that? Is that because there were better diet plans in 1980? No, it's because our environment has changed. Marion laid out very clearly what the food marketing has done for us. The number of fast food restaurants has gone up by a factor of 20 since 1980. You can't escape junky calories. 40% of all retail outlets, everything from the place where you get your oil changed to where you get your diabetes medicine, forces you to walk through a gauntlet of sugar-sweetened beverages and chips and candy bars. You can't drive down the street without being tempted by fast food. And as I mentioned before, you can try to exert discipline, but discipline is a muscle, and muscles fatigue, and pretty soon our genes take over. We drive about 3 times as many miles today than we did in the 1970s. It's time we're not on our feet walking. How many of you guys walked to school when you were kids? Raise your hand. Now, how many of you have kids who walk to school? Look around. There's about 2 hands up. Why have we engineered that physical activity out of kids' lives? The secret to longevity or lasting health does not lie with the folly or the delusion of thinking we're going to get 330 million Americans to get on the same page about what is the right diet and change their habits for the next 30 or 40 years. It's never going to work. It's never going to work if we rely on individual responsibility. The secret lies in shifting the focus from behavior modification to environment modification. Social, the places we live in, the policies, beginning in our own homes, our schools, and our grocery stores, to have the courage to make the healthy choice, not only the easy choice, but the unavoidable choice. We've scored an amazing success against tobacco in this very state here. There's a very clear playbook. Now we need to use that same playbook and take on the soda industry, to take on the red meat industry. It's disruptive to say it, but to take on the fast food industry. We all like fast food, but the problem is it's killing us, and it's bankrupting us, and we need to do something about it. I'm going to close with one quick story. Remember the guy with the bad plaids who forgot to dye? I actually called him not too long ago. I was writing about him. I was in a coffee shop in Uptown, called him in on Ikaria. He picked up the phone late afternoon, speaks perfect English. And I said to him, I was interviewing, and asked him, really the things he did to be 100. And I probably peppered him with 15, 20 questions. He said after a little bit, "You got to hurry this up. I got friends coming over. We're going to do happy hour." And I said, okay, just one last question. I said, "Did you ever figure out," and this is a guy who had lung cancer in the United States, and he moved to Ikaria, and magically that lung cancer went away, and he had no idea how. And I asked him, "Did you ever figure out how you got rid of lung cancer?" He said, yeah, I gave that a lot of thought. He said, "In fact, about 15 years ago, I went back to the United States to get some tests." And I said, "Yeah, what'd you discover?" He said, "Nothing. I got back to the States and all my doctors were dead." Thank you very much.